Welcome. So this is our dinner with the doc. It's kind of a patient appreciation dinner with the doc, so it gives us an opportunity to meet and fellowship with people that are in the practice and people that have family or friends or spouses that are not currently part of the practice. You guys are welcome. And usually most people are asking, you know, he's buying us free dinner, so what's the catch, right? So there is no catch at the end of this. Well, if you guys are guests and you want to get checked out, we'll give you an opportunity to do that at a discounted rate. And if the answer is no and you just came for a free dinner and fellowship, then and you left with some good information, then in my opinion, that's a win-win. So no pressure. A little bit about me. Well, I'm a follower of Christ. I'm a father. I'm a husband, and also a chiropractor. And I never envisioned chiropractic as my profession. I thought I was going to be a real doctor. So I did an internship at a hospital as part of the pre-med program and very quickly realized that that was not the setting for me. And nothing against the hospitals and the ERs. They're amazing places and life-saving for crisis and emergency and trauma. We don't really have any system that's remotely close to what we can offer, especially in Nashville. Like, we've got the best of the best. But what I realized in the hospital setting was that most people that are sick are really sick because of chronic disease. It's not mostly acute disease, it's more chronic. So it's lifestyle disease, diabetes, obesity, cancer, heart disease, autoimmune disorders, fibromyalgia, chronic fatigue syndrome, allergies. The list just goes on. And these are not problems that just happen because of bad luck or bad germs or bad genes. They happen primarily because of poor lifestyle choices and poor environments. And we tend to bioaccumulate the effects of those choices over time, and then they catch up with us. So that was really the question that plagued me, is why are we so sick and what do we have to do to get and stay well? Because if we don't answer those two questions, not much else really matters, because everything else is just symptom treatment and management of disease versus getting us healthy. And I've come to the conclusion that our current healthcare system works a lot like the fire department. So we got a fire department, and if you have a fire, if your body is your house and you have a fire in your house, who do you call? You're going to call the fire department, right? And if you call them and they show up and they're going to kick down your front door and spray down your furniture and your belongings, and if you called them on time and they do a good job, can they save the life of your house? Yes. And should we be grateful for that service? Absolutely. Eternally. The question is, what's left when they're gone? It's a mess. And how much sense would it make to call the same fire department back the next day to fix the house and repair and restore and get the house back into healthy working order? Or would you need a different specialist or a different contractor, someone with different skills to repair and restore and get the house into actual healthy shape? So that's where the current healthcare system fails. There's nothing about drugs and surgery that prevent us from needing drugs and surgery. There's no prevention in that system. And what we actually do call prevention is actually really just early detection. So we look at blood tests, mammograms, CTs, X-rays, MRIs. Those things don't prevent the problem. If I've got a fire in my house, when do I want to know about it? Now, right? But what do I still have in my house? Still got a fire, right? So early detection is not prevention. Early detection has value. We're not going to argue that, but it doesn't prevent the problem from happening in the first place. And that's where we have a crisis in our healthcare system. So I went off to chiropractic school, met my wife after we graduated, started a practice. Things were going really great, and then had my daughter. So it was really kind of like textbook American dream. We didn't have the dog or the picket fence yet, but it was like perfect. Like, things were great. I loved my job. Things were doing great. And then my wife started to get sick about a year after my first daughter was born. And she began with like fatigue, chronic fatigue, where she'd get really tired, and then she'd have trouble getting out of bed. Every time she would stand up, her heart rate would start to escalate to the point to where every time she stood up, her heart rate would go from about 60 beats a minute to 160 or so beats a minute. So that's like us sprinting on a treadmill just for her to stand up and walk into the kitchen, right? So she was subsequently diagnosed with a condition called POTS. Anybody ever heard of POTS? POTS stands for SUCS. It's postural orthostatic tachycardia syndrome, which is a big fancy way of saying that the autonomic nervous system is messed up, so the person's heart rate or the person's nervous system can't manage the heart rate and blood vessel dilation. So it's essentially like chronic fatigue, fibromyalgia, shortness of breath, irritable bowel, anxiety, depression, chronic pain, like 15 things all rolled into one package. And there's no medical treatment, or at least no real effective medical treatment. So we went to the doctors, we went to Vanderbilt, which is considered the experts when it comes to her condition. And guess what they gave us when we went there? We tried drugs, right? And that didn't work, so they recommended more drugs. And then that didn't work, so it was like, so we just kind of went down this rabbit hole of more and more pills to medicate her symptoms versus getting to the root cause of the problem. And don't get me wrong, they were well-meaning, well-intentioned, very skilled, brilliant doctors, but they didn't have the solution to my wife's health problem. And then after we got pregnant again, which was shortly after she began getting sick, we lost the pregnancy in the second half of the pregnancy, basically. So we had her health going south, we had the loss of the baby, and it was just a kind of a cascade of of fear, anxiety, sadness, things that I had no capacity to deal with. And of course, in my own story, that came out sideways later in my own life, which I had to do my own work and recovery with that. But anyway, the gist of it was, and I remember this from chiropractic school. Remember they told us that the power that made the body heals the body? That was everywhere. They had like posters in the hallway that said the power that made the body heals the body. It's like, what does that mean about our body? Well, it means that there's a power that's inside of us. There's a power that animates us, that keeps us alive, that beats our heart, that breathes our lungs, that knows how to heal a cut on your finger. There's a power that's inside of our body that's always been with us from day one. Like when sperm and egg came together, like that romantic night when your mom and dad had that romantic evening and sperm and egg came together, like that, it happened, I promise you. But those two cells, when those two cells combined, all the power that is in you now was in you then. And it started there, and it's never left you, and it won't leave you until you're gone. So those two cells became 4, and then 4 became 8 and 16, and they kept dividing until the first organ was formed. You guys know what the first organ that was formed in the body is? Zygote. The zygote, but the actual organ that forms in the brain. Yep, so the zygote forms, and then it starts forming organs, and it forms the brain first. So the brain is the first organ to form, and then off the brain grows a little tail, and then off that tail grows little nerves, and then you get the heart and the lungs and the spleen and the kidneys and the digestive system. So it's kind of like the tree trunk, the branches, and all the fruit. So in our office, what we started doing, and this is kind of the way we're evolving the practice into the future. So we call it the triad of health. So we have the nervous system, which is first and foremost the master control system of the body, so we have to address the nervous system. And then we have gut health, which is intestinal health. It's the health of your bacteria. We'll go into that in a little bit more detail, but we have to fix the gut. It's estimated that 90% of Americans have a leaky gut. You can Google that. What percentage of Americans have a leaky gut? It's 90% of Americans. So it's virtually everybody in the culture has what's called a leaky gut, and we'll explain the effects of that. And then metabolic flexibility, which is the way that our body uses food for fuel. And that comes down to how our hormones function, how our metabolism works. We get a lot of people that get kind of stuck. They can lose 10 pounds, but then they just kind of get stuck. It doesn't matter what they eat, what they don't eat, how much they exercise, they just kind of get stuck because that person has lost what's called metabolic flexibility. So we want to teach you how to get that back. So the big one to start is the nervous system. So if you look at that brain that sits inside the skull, and one way to know how important something is to your body is how long your body can go without it. So like food is important, right? Well, how long can you go without any food?
3 days.
Yeah, well, you can actually go you ever seen Survivor? Yeah, those people go for like a month and they're still alive, right? So we can go a month with no food. And then, so food's important. What about water? How long can you go without water?
3 days.
3 days, 3 or 4 maybe, right? So water is actually more important to your body than food is because you can't go as long without it. Air, how long can you go without air? Minutes, right? Nobody wants to volunteer to try that. So air is more important to your body than water, and water is more important to your body than food is. So there's something that's more important than air, water, and food, and it's something that we never think about, never check for, never test, or never even consider, and that's nerve supply. So if I cut your head off, how quickly are you dead? Pretty quick, right? Almost immediately, right? If we starve you, it takes a month. If we dehydrate you, it takes days. If we put a pillow over your head, it takes minutes. But if we cut your head off and disconnect the nerve supply, then you're dead almost instantly. So the nervous system is by far the master control system. And the problem is in current medical care, there's really not much focus on the nervous system. Now you can go to the neurologist, which treats the pathologies related to the nervous system, but nobody's working to keep that system functioning. So the nerves that come out of your top part of your neck, if you put your pinky behind your ear, that part of your spinal cord controls everything that you don't have to think about consciously. Breathing, heart rate, digestion, immune function, hormones, everything we don't have to consciously think about is controlled by the top part of the neck. Even our gut. So I learned this 2 weeks ago when I was at a clinic in Tupelo, Mississippi, that within 6 hours of a whiplash injury, the process of leaky gut begins. So you're sitting at a stoplight, somebody hits you from behind, your head gets kind of jerked back, roughly 10, 15 miles an hour can cause a whiplash. So a 10-mile-an-hour car wreck starts the process of leaky gut within 6 hours. Within 7 days, you already have leaky gut because the vagus nerve at the top of the neck actually controls the tight junctions in the gut, which we'll talk a little bit more about in the gut section. So it controls everything. You guys remember Christopher Reeve? Remember? Hey, can you bring me a spine, please? A spine. So Christopher Reeve, remember how he got injured? Like fell off the horse, right? He's horse, like the real Superman. Not talking about this Joker they got nowadays, like the real Superman. So he fell off the horse. It's right there. Poor thing's got her mouth full, like going room to room. Thank you. That's perfect. Thanks. You can take that. All right, so Superman was riding along on the horse, and he fell off. He got bucked, and his hands kind of got tangled behind him, and he chin planted. So he kind of went like that. Chin was the first thing to hit the dirt. I always thought that it severed his spinal cord. That was my initial understanding. But in reality, what happened, the top bone in his neck burst, but the injury was a 1 centimeter bruise on the top part of his spinal cord. That was the whole injury. You could have covered it with your pinky. That bruise on his spinal cord was his entire injury, essentially. But what did it do to his body? Paralyzed him. Can't move his arms and legs. He had to have a tube coming out of his throat, which was a respirator to keep his lungs breathing. Had to have a pacemaker to keep his heart beating. They had to push on his bowels and his stomach to make his bowels move. His immune system shut down. His hair fell out, and he died in about 9 years. Now, if we gave him the best diet, like broccoli and spinach and the perfect smoothie you could ever imagine, would he ever get back to health? Clearly no. What if we gave him the best trainer, the best exercise program, or the best drugs, or the best surgeon, or the best whatever? The only way to get him back to health is to allow his brain to communicate with his body. That's the focus of chiropractic, because everything in our bodies run on chemistry. Like everything in our body is a chemical reaction. So for you to wake up in the morning, your body has to release a chemical. For you to go to sleep at night, your body has to release another chemical. If this room was on fire and you had to jump up and run out the front door, your body would have to release a chemical to raise your heart rate. It's called adrenaline, to get your butt out of the office, right? If you fall in love, that's a process of a chemical reaction. If you go out during the pollen season, if you go out and there's pollen or ragweed, do you know what chemical your body releases? Histamine. And if your body releases the proper amount of histamine, you don't have any symptoms. You don't even know there's pollen or ragweed in the air. But if it produces too much histamine, guess what you get? You get the watery eyes, you get the nose that's running. So what do you take for that? Take an antihistamine, right? So we've got all these pills to counteract when our body's actually overreacting to the environment. So everything in our body's related to chemistry. Now, the brain is the master chemist. So the brain is actually the organ that controls all the chemical reactions of the body. That's why this is so important. It's not about, will you grab me that little wire over there on the other side? The nervous system is literally about 9%, 6 to 9% of it is pain. So a lot of people think, well, I'll go to the chiropractor if I have pain. If I hurt, then that's when I'll go. Well, if you look at the way the nerves work, like if you you have 31 nerves on the right, you have 31 nerves on the left, and if you kind of take a cross section when they come out, Those nerves, by the way, they transmit electrical information at 268 miles an hour. So if you had an Indy car zipping through this office at 268 miles an hour, how quickly does that signal go from here to there? It's like an instant. It's amazing. The more I learn about the human body, the more amazed I am at God's creation. It's unbelievable. But when you look at the nerves, only 2 of those, there's 9 fibers within each nerve. 2 of those control pain. So only 2 of them are for pain. 4 of those control your muscle function. 1 controls your balance, and the other 2 control your autonomic nervous system, which is everything you don't have to think about. Your brain, your heartbeat, your breathing, your digestion, all the organ functions of the body. So pain is just a really, really small piece of the actual puzzle. So what we're looking for is where the spine is out of alignment or out of position. Because people say, well, how does your spine get out of alignment? And it's one thing, it's called trauma. And you have 2 kinds of trauma. You have your big impact trauma, like car wrecks and falls, injuries, contact sports, falling and bumping into the curb. There's lots of different ways that you can get injured. So those are like your big T traumas. Those are kind of your obvious ones, right? It's estimated that by the time a kid turns 5, around the time they start kindergarten, they've had about 2,000 spinal traumas, according to OSHA. That's falling off the changing table or falling down the stairs. I've got a 1-year-old, he's 17 months old now, and he probably falls, 30 times a day. Just literally, he does that little diaper drop where he kind of from a standing position straight down. If I did that, you would have to take me straight to the ER. But he does it over and over and over again. So the average kid, and then we have a car wreck. How many of you had a car wreck in the room? Right? That's like every single hand virtually. So car accidents, and a 10-mile-an-hour car wreck is the same as a 50-pound weight hitting you from a 2-story building. So if you've ever been in like a 10-mile-an-hour fender bender, that's the same as a 50-pound weight hitting you from a 2-story. That's how much it jolts the spine and nervous system. But we always say, well, I wasn't really hurt. Well, how do we judge injuries in America? Severe pain, broken bones, or blood. So if you're not bleeding, you don't have a broken arm, or you're not in severe pain, then we say you're fine. Suck it up, walk it off, you're fine, Well, we can do a lot of damage without having those injuries. And then the other kind of trauma is your small T traumas, which are your postural traumas. So what do most people do all day long? They sit at a computer. Your spine is supposed to be in this straight upright position, the way God designed us. But what most people do is they get up in the morning and they kind of walk over, they kind of slumber out of bed, and then they go brush their teeth, then they go sit down and eat their bowl of cereal, and then they drink their coffee, and then they drive to work, and then when they get to work, they sit at the computer all day, and then they get home, and they drive back home from work. They get back home, they sit down in their recliner, so we're kind of sitting in this horrific position. Then half you guys probably sleep on your stomach at night, which is like contorting and twisting your spine in all kinds of weird places. So we do a lot of damage to our spine, and we're designed to be hunter-gatherers. Do you guys realize we're animals? Yeah. It always cracks me up. I see the restaurant sign that says no animals permitted, and there's humans in there eating. It's like we're all animals. Somehow we think we're disconnected from the human, like we're part of the animal kingdom. And imagine if you took a monkey from the jungle and you put him in Franklin and you gave him like donuts for breakfast and a latte on his way to work, and then you gave him like a cheeseburger with fries for lunch, and then at night he eats a big bowl of pasta, and then he stares and watches Netflix all day, never exercises. What would happen? Does the health of that chimpanzee get better or worse? How many times out of 1,000? Every time. So what would the solution be? Would it be to give him like the right cocktail of drugs to manage his depression and his achy hip, and give him a bunch of pills to try to make him feel better as he deteriorates toward the nursing home? Or would it be to get him back to the way he's designed so that he can eat, move, and think in ways that God designed his body to work? So that's the same for us. I remember, you've seen that little poster of the dogs sitting around the poker table, smoking cigars, drinking whiskey? That's awesome, isn't it? It's like funny, but it's how is that less ridiculous than us doing that? Like, because we're doing the same thing. We're smoking cigars and sucking in the fumes from that awful carpet. So we have to start thinking of ourselves as part of the animal kingdom. And I'm not saying don a loincloth and start living under a tree somewhere and eating berries all day. Like we gotta be American, but we also have to remember that that's how we're designed. And the sad thing is with the kids, thank you. So with our kids, and I see this all the time too, we'll say, no, Timmy, don't give that soda and chips to the dog. That'll make him sick. That's for you and your friends, right? So much that we can laugh about that. But really it's murdering children, and we just kind of, it's part of our culture, right? We just tend to do that. So that's the nervous system. So our job really is to find where the spine's out of position, and we use a general maneuver, whether it's with instruments or by hands, to get the spine back into position to remove the interference. So my job is not to treat your hip or your back pain or help your liver or help your digestion. Our job is just to remove the interference so your body can heal itself. Because if you cut your finger, what happens? It bleeds. What happens a week later? It heals. Sometimes or always. Anyone ever had a paper cut that never healed? No, always. You broke your leg, right? You guys both broke your legs. They're in like a competition to see who can break their leg the best. But the doctor probably put it in a cast or maybe put a pin in it to stabilize it. But who does the healing? We do. So doctors don't heal you. Chiropractors don't heal you. Surgeons don't heal you. And drugs don't heal you. Your body's the one that does the healing. And that's another thing that we've forgotten in this whole victim-based, fear-based culture, especially now after COVID that we're in. We give the body so little credit, but your body's designed to be healthy. And everything we think about health has been taught to us wrong. Is a fever healthy or sick? You're sniffing a trick question. Healthy, right? It's healthy because what's the body doing? Yep, it's heating up the core temperature. It does other things too, but it brings the immune system, it sends the troops into action. It heats up the core temperature to make it inhospitable to bacteria and viruses and invaders. Did you know if your fever gets to about 102, roughly 102, you can fight off just about any bacteria. Almost no bacteria can live at 102. If you get around 103, almost no virus can live in your body at 103. If you get around 104, then your body releases a chemical called interferon, which kills funguses and spores and mold. Almost every pathogen you can imagine is killed when we get to that temperature. But what's the first thing we do when we get a fever? Bring it down. Because we're smarter than the body. We're smarter than God. Right? We know that fever is dangerous and it needs to go down. But the body's saying, no. I need to raise that fever because we got to fight off the bugs. Did you know do you know what the dangerous limit for fevers are? Like where you really need to be concerned, what the number is? A little less, it's 107.5. So 107.5 is the point at which you should actually start to get a little worried. Now, a high fever can cause a febrile seizure. That's fact, but febrile seizures are completely benign. Scary to watch, but there is no data, because I was raised to believe that if your fever gets high enough, it'll actually cook your brain. You guys talk, that's an old wives' tale. There is no data to support that whatsoever. That is 100% a complete old wives' tale. If you find the data that proves that, please bring it to me, because I've asked this for years, no one's ever brought it. There's no data to support that a high fever causes brain damage. But the seizure, which is kind of the body's reset button, and nobody wants to watch a kid go through a seizure, but those things are completely benign. So coughing and sneezing, is that healthy or sick? I don't know, especially with COVID. You don't want to be around somebody that's coughing, right? But it's the primary way that your body expels bacteria, viruses, and particles from the upper respiratory tract. It's actually brilliant. Your body coughs and sneezes to get that stuff out of the system. And then what about diarrhea and digestive issues? Healthy or healthy, right? Now, I don't want diarrhea or fevers, and I don't want to be coughing. I'm not advocating that. But that's just our body doing the right thing at the right time. And not to say there's no need for intervention, but we intervene too quickly, too fast, and we forget our body's designed to be healthy. So that's the nervous system. The next big focus is the gut. So we know that about 70% of your immune system is in your gut, is in your digestive tract. So there's a thing called intestinal permeability, or leaky gut is another name for that. So your gut lining is essentially like a screen door in the house. So you have like a screen door in the house. You can leave the door open, but you keep the screen there so it allows air in, it allows bad dust stuff out, but it keeps the bugs from coming in. So most people, when they have leaky gut, it's like the kid throws the softball through the screen and busts a big hole through it. So now you get bugs and you get mosquitoes, you get wasps. So what does the current medical system do? It's essentially, and the analogy is like running around the house with like Black Flag or Raid, and you're trying to kill all the bugs. Because that's what we do. Because if you get an infection, you take an antibiotic, which has value sometimes. But we're killing the germs versus fixing the reason why the germs are there in the first place. Because when your gut becomes permeable, it allows proteins, it allows bacteria. Your food actually travels outside of the bowel, and then your immune system begins to attack it. So it's the precursor for autoimmune disease. So almost, and I would say 100%, but we never say 100%, but a very large percentage of people with autoimmune disorders, like lupus and rheumatoid arthritis, and the list is a mile long, all have leaky gut. So 70% of your immune system is in your gut, and by fixing the gut, we know that it enhances your mood, enhances hormone balance, reduces pain and inflammation. You get a stronger immune system, better energy, less food sensitivities, less anxiety and depression, improves the absorption of nutrients, your brain works better, less risk of disease, reduced seasonal allergies, and cleaner skin. Because as it stands, 1 out of 2 men and 1 out of 3 women will get cancer in the U.S. It's 1 out of 2 men and 1 out of 3 women will get cancer in the U.S. Was that true 150 years ago? No. So is it our genetics? Because that's what we've been told. Because we're trying to find the gene for breast cancer. We're finding the gene for colon cancer, the gene for obesity, the gene for diabetes. We're looking for the gene for everything, but our genes really haven't changed. Our genes have changed 0.004% in the last 20,000 years. So our genes aren't changing. It's our lifestyle and it's our environment. So 1 out of 2 men, 1 out of 3 women, 5 out of 6 Americans will die of either heart disease or cancer. That's 5 out of 6 Americans. It's 83% of Americans die from either heart disease or cancer, largely preventable. It's estimated that over 90% of heart disease is fully preventable, and about 80% of cancer is fully preventable. Now, those 5 out of 6 that die of heart disease, is that because they forgot to take their pills? No. They're going to take their pills, more pills than they've ever taken, and they're going to die anyway. We're going to take pills for cholesterol and pills for blood pressure and pills for allergies and pills for hormones and erectile dysfunction and reflux and IBS. We'll take pills over pills over pills, and we continuously get sicker and sicker and sicker. Do you realize we're about 5% of the world's population? What percentage of the world's pills do you think we take?
50.
Higher. 70. About 78%. So we make up 5% of the world's people. We take almost 80% of the world's pills. Now, where do you think we rank in terms of health? High or low? Yeah, dead last. In all the industrial, we're like Ecuador and Venezuela healthy. Cuba outranks us. Even in infant mortality, Cuba is better than us. So it'd be one thing if we're chugging all these pills and we're getting healthier and we're dancing on the beach, but we're not. We're getting sicker with cancer and we're living in nursing homes. So that's why we want to change this practice, because even 15 years ago, I remember we would adjust people and like their digestion would get better. Or we'd adjust people and their allergies would clear up almost immediately. Or kids with ear infections, one adjustment, it's like a miracle. Well, now that doesn't happen very often anymore, rarely, because people are just so much sicker. So we have to take a multimodal approach to a multifactorial disease condition. And that's what we're looking to do. So the other one is our metabolism. And there's a thing called metabolic flexibility. And by the way, these all feed off of each other. So your nervous system talks to your gut talks back to your nervous system, controls your metabolism controls or talks back to your nervous system. These are all very interconnected. And imagine if we could fix people's guts, balance out their nervous system, and fix their metabolism, what do you think would happen to cancer? Heart disease, autoimmune disorders, fibromyalgia, depression, anxiety. Do you know that they're calling Alzheimer's and dementia type 3 diabetes? Anybody heard that? Look that up. Type 3 diabetes. Because we know the connection between gut permeability and an impaired metabolism drives Alzheimer's, dementia, and all of these neurodegenerative diseases over time. It's not normal to lose your mind when you get into your 70s and 80s. We're supposed to live to 119. That's the most common estimate. University of Texas did a study in 2004. They found that the human body is designed to live about 119 years. Now, I don't know about 119. Like, that might be a little much. But I want to live to, I want to live long and die quick. That's my goal. I want to die young as late as possible, right? I want to die really, really young, really, really late. That's the name of the game. Because I got kids. My son, I'll show you this in a second, but let's talk about the metabolism. So your metabolism is essentially another way of saying your hormones, but it's essentially what your body primarily uses for fuel. Because most people we see are almost exclusively sugar burners. So you can burn sugar or you can burn fat. The problem is if you eat too much sugar, too many carbs, bread, pasta, cereal, crackers, chips, pretzels, cookies, bagels, muffins, pastries, oatmeal, and donuts. If you eat too much of that stuff, then your body is pegged toward only burning sugar. You cannot effectively use fat for fuel. Now, if you starve yourself or if you do a fast of some sort, then your body's forced to use fat for fuel. Now, in a healthy person, they can use fat when there's the absence of food, and then they can use glucose when they actually have food available. So it's a very dynamic system that can switch seamlessly back and forth. This whole thing where, and I was raised in sort of like especially like in weightlifters, you got to do breakfast, lunch, breakfast, snack, lunch, snack, dinner, snack. You guys remember that? Like the 6 small meals per day? And then we have like low-fat cookies and low-fat donuts and low-fat cereals, and we have more high-fat people than at any point in history, right? So that eating all the time, our ancestors never did that. Like Jesus didn't have access to breakfast snack, lunch snack, dinner snack. Like there'd be periods of time where there was just no food. There was no woolly mammoth to kill. Like you just had to kind of starve for a bit. And that's healthy because it teaches our body to use fat for fuel. So we have some comprehensive testing to find out exactly where you're at on that scale. But I will tell you, your body preferentially would prefer to use fat for fuel. It's more effective. It's like using kerosene or jet fuel. That's the difference, really. Has anybody ever done intermittent fasting? You've done that before? How do you feel, once your body gets adapted to that, how do you feel a week or 2 or a month later? You feel better, right? Like I don't eat lunch until 1 or 2 p.m. every day. I stop eating around 8, 9, and I don't eat lunch or breakfast, I guess, until about 1 or 2 p.m. And the only reason I really eat is because it's like time to eat. Like my wife's eating, I guess I'll eat with her too, right? So it's like time. So your body's designed to go long periods without food. But if we keep giving it food, even if it's quote unquote healthy food, then we'll never make that switch to using fat for fuel. So we'll talk through some of the dynamics of this. I've got other workshops on our website that kind of walk through all the specifics of how to do this in detail. If you got any questions, I'll be happy to help with that. So that's the triad of health. I want to fix the hormones, fix the gut, and balance out the nervous system. And by the way, too, if you're making strides in each of those 3 categories, then you don't have to do anything perfect. Like we get overwhelmed, like, well, I'm going to eat birthday cake sometimes, or I'm not always going to get in here and get adjusted every week on schedule. Like there's going to be times where I let some of this stuff slip, but the more of those boxes that you're checking, the less you have to do any of them perfectly. Does that make sense? Because a lot of people do the perfect diet, and then something's still missing. Or they'll do the perfect gut detox, or they'll come in here and get adjusted, but they're still slamming down cheeseburgers and fries every day. Like you got to do the whole picture if you want to be a whole healthy person. So warning signs are things like allergies, headaches, menstrual problems, high blood pressure, depression and anxiety. You can probably put those 2 on there. Insomnia, sciatica, low back pain, carpal tunnel, neck, back, and joint pain, dizziness, fatigue, acid reflux, numbness, tingling, asthma. If you go to the doctor with asthma or allergies, what are they going to give you? Yep, they'll give you a drug, antihistamine. You get a drug for that. What about if you have headaches? Drug. Menstrual problems, you get a blood pressure, you get a depression, insomnia, sciatica. Like, so there's pills for all that stuff. None of those things are the problem. None of those are the problem. Now, they're the blinking light on your dashboard that's the check engine light, but those things are not the problem. Those are the smoke detector, right? So by taking the pills, all we're doing is taking the batteries out of the smoke detector or taking a little ball peen hammer and smashing the light out on the dashboard. Like, fix that one. Like, that was good. So we're suppressing all of our symptoms while the engine's still failing or the house is still on fire, right? And I'm not telling you never take drugs for anything ever. I'm pro people taking as little drugs as they need for the least amount of time as possible. And my sister's type 1 diabetic, so in her case, she has to have her drug, her insulin. Like, I wouldn't have a sister if she didn't have her insulin. So they do have place and they do have value, but not at the pace that we've been doing this currently. So this is my little family. So, and this is an old picture. I need to update this. So that little man, so the little story about my wife, so she was bedridden for, I say bedridden, that's a little dramatic. Like we would drive to go get food, like she'd get in the car, things like that, but she never drove her car. We never went to church or to the movies or out to dinner. We didn't travel. So for over 2 years, like she was essentially bedridden. I remember we leased a car, which is a terrible thing to do with someone who's bedridden. And I think we put like 100 and maybe 200 miles on the car in 2 years. The guy was like, "Are you serious?" We went to turn it in. He's like, "Are you really going to do this?" I was like, all right. But anyway, nothing, right? So along with that, because when she lost her health, guess who it affected? Her, me, her, everybody. Everybody who's in your life. Because when you lose your health or when your health suffers, guess who gets affected? It's the people around us. And nobody wants to, raise your hand if you want to be a burden to your family. Like, nobody. You want to be, no, you raised it improperly. Nobody wants to be a burden to their family. I remember my grandfather used to say, like, if I ever get sick, just don't put me in a nursing home. Just put a pillow over my head, right? It's like, yeah, throw me in the ditch. Take me out back and shoot me. Yeah, because that ain't how it plays out, right? The way it plays out is they go to a nursing home, they drain all their savings, all their legacy, everything they were going to leave to their kids, that gets drained. And then my dad had to go up there every single day for about 3.5 years to deal with him attacking the nurses and running around naked. And like, it was literally his whole life was now dedicated to dealing with him. So that's the thing we have to start thinking about now, because Alzheimer's, dementia, that probably scares me the most. I'd rather lose my body than lose my mind. But do you know when Alzheimer's starts in most people? 20s, 30s, 40s. You know, stage 2 Alzheimer's is forgetfulness, or it's lack of concentration and forgetfulness. That's stage 2 Alzheimer's. Raise your hand if you know someone who has lack of focus and concentration and is sometimes forgetful. By the time you get to stage 5, you're pooping on yourself and somebody else has to clean it up. That's stage 5. So literally, these problems start far earlier than the medical test can ever show. And there's no drug for Alzheimer's. None. They tell you there is, there ain't. Look at the research. Look at the data. Those drugs do virtually zero good. In the cases where they've shown that it does provide some marginal benefit, they have monkeyed with the statistics. Statistics are like a Guantanamo prisoner. If you beat them hard enough, they'll tell you anything you want them to tell you. That's the way that works. So we can't rely on the pill fix. So anyway, she was bedridden for a couple of years. Then we finally kind of had to revamp everything we thought about. And I was a chiropractor. Like, I was in the wellness world, and I can't help my wife, so we had to change the way we were adjusting her. We had to change her diet. I remember we got rid of the bread and the pasta and the cereal. All the grains were gone. So she ate meat, veggies, and fruit. That was her diet. God food, right? Food that God made for us to eat while we live on this planet, right? So none of the processed stuff. She still ate a little bit here and there. And then she started exercising, because exercise is an essential nutrient to the human body. It's not optional. It ain't to look better in a bikini. If you want to be healthy, you have to exercise. Just like air, food, and water, exercise is an essential nutrient to the body. And she started, I remember I had this patient who was a trainer named Jonathan. Super sweet guy. But I would come home from lunch on my lunch break and he'd be like stretching her in the living room. It's like, what's going on in here? But that's where she had to start. Like, she had to start with stretching. She did like yoga in the floor, and then she progressed to like a recumbent bicycle, and then she got to where she could do like beach body type stuff. And that didn't last very long because those things are too hard, but she kind of found her sweet spot. So if she can exercise, what's our excuse? None of you guys are bedridden. So like in the morning where I don't want to get up and go work out at 5 a.m., that's part of that. I remember like, she did that and she couldn't even get out of bed. So what the heck am I making excuses about, right? So we all have to exercise. And then we started detoxing her body, repairing her gut. She didn't do very well with certain supplements, so we had to basically do it with food over time. But then gradually over time, we began to get our life back. Because as you get I like to say, if you get your wife back, you get your life back, kind of thing. And that's not to put that on her. And then this little guy, we never thought he would happen, because we thought that, one kid was going to be it. We had one here, one in heaven, and that was just going to be our future. So that is a gift. That's a gift of health, right? Because when you get your health back, then the whole world just opens up. And now we go on vacations, we travel, we don't do like CrossFit together, but like we do fun stuff because we got our health back. So that's what I would ask, because it's hard to think about like Alzheimer's and dementia and kind of what that looks like with our family. But if we can kind of look at the here and now, I would argue that there's probably some of you in the room that are probably harming your family currently because you could be healthier. And that's not to shame or blame or to put that on you that way, but if there's things we can do today that would make us healthier, that would allow us to give more to our families in time and energy and legacy, then I think it's on us to do that now. When's the best time to get healthy? No, it's yesterday. Yesterday. When's the second best time? It's today, right? It's not someday. There's 7 days a week, Monday through Sunday. Someday is not one of those days, right? Today's the day, right? So with this, if you're having these symptoms, if you're one of the guests in the office, we do an initial exam, consultation. We're going to start doing this at $139, but we're just doing it at $39 instead of $139. So if you want to get checked out, get x-rayed, there's no pressure with that. We get a view of your spine, kind of see what everything looks like. And then if you want to see how we can help and work together, then we'll talk about that. And then if you don't, then it's no fair game. But at least you know what your spine looks like. Because if you haven't looked at your x-rays, there's no way to know what your spine looks like. Because remember, only 10% of the nervous system controls pain. So we can't base it on just how we feel. And then lastly, these are some of the new services. So this is what I'm really excited about. I'm terrified and I'm excited about. These are some of the new things that we're going to roll out in the office. We've always done corrective chiropractic care. So raise your hand. That's you. Raise your hand if you guys have done other chiropractic care before. Like that's almost everybody. Now most people don't realize this, but most chiropractic is based on just symptoms. Your neck hurts, you go in, you get popped. Neck hurts again, you come back again. It's kind of a pain relief type setting. So there's no addressing the soft tissues, the ligaments and the tendons and the muscles to retrain the spine to hold that new position. So in our office, we use pre and post x-rays, PT, rehab, home care to try to get the spine into the most stable position as possible so that you can live a long and healthy life. But you can't validate if you're fixing it without retaking the x-ray. That's part of so post x-rays are a big part of that. And then we are rolling out lab testing. So we actually just started this now. So it's blood, urine, a cheek swab. So the blood can tell us, well, let me show you mine. So I did this the other day. I just got my results back. So the blood and the urine testing can check for need for antioxidant support. So it gives you a list of all like the B vitamins and the omegas, kind of tells you exactly what your status is and what you need and how much to take if you need them. It tells you your need for mitochondrial support. Your mitochondria are the energy powerhouses of the cell. So if your mitochondria are suffering, your energy is suffering. And then omega balance, that's one that I scored pretty moderate to high in that I really needed help with. So as much as I think that I eat healthy, I'd kind of slacked off on taking my fish oil because I take it, twice a week kind of thing. But now I realize I need to be taking that every single day. And that wasn't going to show up on a blood pressure cuff or on a traditional medical test when they do my cholesterol and my liver enzymes and do your urinalysis. They don't normally find that on those tests. So this is a much more deep dive. It's really diagnosing the breakdown of the metabolic pathways. So we don't want to see like what your end stage disease looks like. Because how many people know someone who went to the doctor, they got a clean bill of health, they were healthy as a horse, and they died of a heart attack a week later? Like, we all know those people, right? Because the testing doesn't tell us what the health spectrum looks like. It just shows us where you're at according to end-stage disease. So omega balance, exposure to toxins, and the last one is methylation imbalance. So that's tested on the first with the blood, urine, and then the cheek swab is a genetic testing that kind of tells you your risk factors for certain diseases. I'm still waiting to get that result back. And then stool, good old stool. I've been putting the stool test off because it's a 3-day collection. I know you guys just ate, but they do give you like a tray, like you get curly fries at the fair, you get a tray like that, and they give you rubber gloves. So, but that tests for pathogens, intestinal permeability, gut function. It gives you a real clear picture of how healthy the gut is. So get your spouse to help you. And then nutrition and weight loss. So we have a 6-week nutrition and weight loss program. It's called ChiroThin. If you guys are interested, you can scan this little QR code and it sends you like a, was it 15-minute? 15-minute video that kind of explains the program. Most people lose about 15 to 30-ish pounds. Of course, men lose more than the women do because, you know, it's not fair. But yeah, but it jump starts you with healthy food, no gluten, no dairy, no sugar. We give you the recipes, exactly what to eat, when to eat it, and then we check in with you once a week to kind of walk you through your progress. But most people in the 6 weeks usually lose about 22.5 pounds is the average for women, and it's about 28 to 30 pounds for men. So that's in 6 weeks. And that's not a crash diet. It's resetting your metabolism. It's resetting your metabolic set point, which is how many calories you burn per day doing nothing. And for the people that do that program, we do like a 20-pound guarantee. So if you don't lose 20 pounds, we'll do the program again for free. It's on us. So, customized